Like we're good to go. Today we are talking about rebound headaches. I want to talk about medication and migraines, and then specifically about how they can impact us and cause rebound headaches, or it's also known as medication overuse headaches. Now, as a disclaimer, to start out, I am not a doctor. I do not diagnose, I don't prescribe, and any decision to reduce or eliminate medication has to be made. It's a decision you have to make with your doctor, and it should be discussed with your doctor for safety reasons, because some medication has to be tapered. Some medication, there's a safe way to reduce it or to eliminate it. And so that conversation needs to be had. So I will say that just so there's no confusion around it and nobody does something that's going to be dangerous for them. And I'm gonna begin by saying that I am not against taking medication. It's not a black or white thing, I know that, but I am about looking at other solutions first or alongside medication, where you use it as a bridge to get you to an ultimate goal of no medication, or at least greatly reduced medication. I am about doing everything within our power to avoid having to rely on medication, especially regularly, and years on end or for life. So I feel this way for several reasons, and you probably can agree with some of them. For one, there are risks to taking any kind of medication, short-term risks, long-term risks. The type of side effects or adverse events will vary, and unless your doctor tells you about them or you do your own research on them or read the package insert, you won't know unless you experience some of them for yourself and make that connection with your medications. I've heard many of you tell me that you've stopped a medication because of the side effects that you were having. Sometimes they were worse than the migraines themselves. So you decided to stop them for that reason. And that's totally fair. Why take a medication if it's not helping? Why take a medication if it's causing you side effects that are equally uncomfortable? So number two, and this one ties into number one, is that medication can actually cause symptoms that you end up having to take other medications for, or being put on other medications to deal with. And that one leads to the next. So you have one symptom caused by medication, so you take another medication to cover that symptom, and then that medication causes additional symptoms that you need to take medications for. So it's this cycle that you get into. And I mean, this is side effects happen, or symptoms happen, because medication goes everywhere in the body. So even if it's helping you for one thing, it could be causing imbalances or trouble somewhere else. For example, the medications we take to constrict blood vessels, it doesn't only happen in the brain. It can't just constrict the blood vessels in our brain. It happens everywhere. So number three, as for reasons I don't look to medication first, or I look for alternatives to medication where possible, is that they can be costly, especially obviously if you don't have coverage. And I know, my mom was paying $20 a pill for her migraine medication. She didn't have coverage for a time, for a good chunk of her migraine history. And so, yeah, she was like, every time she had to take it, was like, there's $20. And I've spoken to several women who did find a medication that worked for them, but then their coverage stopped or was going to stop, and they would have to be paying out of pocket, and that became much too costly. And so they had to come off of it and find an alternative, or just suffer. So that's hard, right? When it can cost you thousands of dollars a month to be on medication. It's kind of another con to medication. And then my last point here for why we don't want to have to rely on medication is that it can cause more headaches over time. And this is what this is going to be about. This conversation is going to be about. There are a few reasons for that, and I'll be getting into them today. So in this live, I'll start out with talking about what rebound headaches are, how to know if you're experiencing them, which meds can contribute to them, and then finally, how to end the cycle. And before we get into that, I'll tell you a little more about my own history with medication, because I want you to know that I'm not judging anyone here for taking medication to manage their migraines. I took over-the-counter medication through my teens when I got a migraine. I started on a prescription medication in my 20s when they started to become more regular, more severe, and the over-the-counter stuff just wasn't cutting it. And I never really loved the idea of taking medication, but at the same time, I didn't question it much in certain circumstances. So the only other medication I really took in those years was birth control. I was on the birth control pill, and which also can contribute to migraines in various ways. And later, I learned this, that there's things that being on birth control can do with when it comes to creating imbalances, deficiencies, and that kind of thing that can actually contribute to your migraines over time. Some people will take it and get migraines, so they have to come off of it or change up their type of pill. But in general, I prefer not to take medication and look to alternatives wherever possible. But for migraines, I felt it was different. And I think it's because of that intensity of the pain and how awful they were. And because I trusted my doctor, and medication was the solution that she presented to me. She said, you're a migraine person. This is hereditary. Your best bet is to take a triptan at the first sign of a migraine for the rest of your life, as long as you're getting them. And I mean, she didn't say that last part, but I came to realize that that was it, that this is my tool. And now each time I get one, this is what I'm going to do forever if I continue to get them forever. And I also probably look to meds first because it's how my mom dealt with her migraines. We have actually shared the same doctor, and I recently had a conversation with my mom, and she was telling me that all of the different medications that she had worked through, and turns out that I was started on the same triptan that she had landed on after trying all of these other options. So my doctor put me initially, like right off the bat, put me on the same thing that my mom was on, knowing maybe because we're in the same family and she knows what works for her, it's going to be more likely to work well for me. And that's fair. But maybe I was started at a higher dose than I needed, or maybe there was something better out there for me medication wise. So, and my mom and I also shared a lot of the same philosophies on health, and I trusted my mom. I trust my mom. She was a personal trainer. Our family was always very health conscious. We, of course, since then, I know more too about what is, quote unquote healthy and not healthy, or what's considered to be health promoting in our body, and the different reasons why certain people should be eating some things and not others, and living a certain way and not in another way. So I wasn't doing things perfectly, for sure. But all this to say, we tried hard. We could have probably had way more migraines than we were getting if we had been living a different lifestyle. But the fact is, still getting migraines despite how hard we were trying, taking medication. And, I assumed that we were doing everything we could, so the medication was necessary. So let me know in the comments let me know when you were first diagnosed with migraine, and were you handed a prescription right away? Was that kind of the first go-to advice as well from your doctor? Or was there any conversation around non-medical ways to manage your migraines or prevent the migraine attacks from happening? Was there mention about food and lifestyle, and how that can play a role? Did your doctor ask questions about your sleep and about your food and about your stress levels and all of that? To me, even if advice is high level, even if it's generic, it can be encouraging to hear these things from your doctor to kind of get a sense that there is some control, that we have some power over things, and that we don't have to hand it all over and just, as I say, rely on the medication to work. So anyway, I saw that over time, my mom's migraines were actually getting worse and worse. Again, despite all of the healthy things, despite living an active lifestyle and, continuing to try to look for solutions, she was having to take more medication and at a higher dose, and it didn't always work. And she would avoid trying to take them for every single migraine, but if she waited, it would more often than not explode, and she'd have to take another pill and higher dose or more doses of it, and then go through more pills faster than she would have otherwise if she'd just taken it at the first sign. And I understood that because it would happen to me too. Even not getting them as regularly, I'd think, this isn't going to be a bad migraine. I'm just going to wait. I won't take the medication. And then it would end up being a bad one. The pill then that I would take wouldn't work very well. And that's where I would be left. So, with my mom feeling discouraged about her situation, she was reassured by her doctor that migraines would very likely go away after menopause. After she hit menopause, she was postmenopausal, they would probably not happen anymore. And she held on to, I think she held on to a lot of hope for that. Maybe subconsciously, she even relaxed a little bit in her efforts to try to deal with her migraines, to try to manage them without medication. But she was suffering in the meantime because even when the pills worked, she was tired and she felt crummy. And I don't think she saw the transition as much as I did, but I noticed her always saying either that every time she would come visit us, it was either she was just getting over a migraine, or she was in the middle of a migraine, or she could feel one starting up. And it really got to that point. And seeing that, and then knowing how much how much we're alike, I decided to keep trying to figure things out for me and for her. I was gonna keep searching, and in a way, I had always been hunting. Like we both like she was also going to the chiropractor. She tried acupuncture. She saw a massage therapist. She, again, was eating well. She was taking supplements. And I did all the same things. I saw a holistic nutritionist for a few appointments and started on a few supplements that were known to be helpful for migraine, but still didn't shift anything. I saw another type of holistic health practitioner every month for years who prescribed botanicals and homeopathics and supplements and did laser therapy of some kind and acupuncture in my ear. And, I'm not discounting that these things can be helpful. I plan to visit him again and my chiropractor again as soon as I can. It's been over a year now since I've been able to see any of them, but I do look forward to that. But it did feel like a lot of throwing spaghetti at the wall. None of these things, even when doing them in combination, was getting at the root causes of my migraines. And as much as these approaches are natural, they can still be considered to be band-aids because they just help with some symptoms temporarily, and things would fall out of balance again. It wasn't a comprehensive plan that addressed the root causes of my migraines. So, I was, in a sense, now looking back, I was still looking outside of myself for the answer. And while it's usually necessary, it is necessary to have help, to have someone that has the expertise, that has an external perspective, that can provide support when you're going through hard things and making changes. It does actually take a combined effort where you sit down, you figure it out together and play detective together. You can't rely 100% on someone else to do that for you, and you can't do it 100% for yourself either. So working through a journey together in true partnership, that is until, you get to the goal, until you see progress and you're moving forward, that's really the ideal scenario. But that's not what any of the practitioners that I saw offered. As wonderful as they were and are, that's just not how they operate. And, not a lot of practices are set up to be able to provide that. So anyways, I know I've gone off on a little bit of a tangent here in the beginning. We will get into the rebound headache now, but I just, I did want to mention these things and share a little bit about my perspective and my history and why, kind of how this has all come to be. So rebound, what is rebound? Rebound is when the medication that we take to manage our migraine symptoms starts to actually cause additional headaches, and or they increase the length of our migraine episodes or the severity of the pain of our migraine episodes. And sometimes they can be harder to manage with meds as our pain intensity increases and the length increases and all of that. They become more difficult to manage with the medication that was, initially saving us. So the updated term for rebound headaches is medication overuse headaches, or MOH, but I find that misleading because we can actually be taking quite a low number of pills, and lower than what we've been prescribed, lower than the dosage on the bottle, and still experience rebound. We can be, like I say, following instructions and still be in that zone. So this can be because you're taking other meds. So you're taking your medications per prescribed, and you're also taking other meds that can also lead to rebound in combination with that. So you're overall exceeding the recommended dosage of a category of pills, or it can be because the toxic load of the pills is too much for your body. This is where I've written about this in a couple posts recently, but it is personal because it depends on your own your own physiology. It can depend on the lifestyle factors that are contributing to levels of inflammation in your body and to your body's ability to detoxify things. So that differs from person to person. It's about, really, when it comes to that overload, toxicity overload, inflammation, it comes down to what we're taking in, and then what we're able to get rid of or transform. So detoxification a lot of times is considered like our body's organs have ways of transforming things into things we can either use, or then prepares it for elimination. So if you're not physically active, and you're not moving your body and moving your lymph system around a lot, getting those fluids moving, if you're not sweating regularly, if you don't drink enough water, if you're eating things that tax your detox organs, like if you're eating a lot of processed foods or trans fats, there are things that can bog our system down other than medication that kind of just adds to that load. And then the medication itself can be stuck in our body longer than it should. So maybe you're only taking, let's say, 6 to 9 pills each month. But, and that's what you were prescribed. That's what you're allowed. But what happens is that Rebound, it develops over weeks, months, and years. Because medication, it stays in your body. It stays in longer if you're not detoxing well. It stays in longer if you've got other things bogging things down. But yeah, it really depends on how efficiently your detox organs are working, as far as how fast that medication can then be detoxed or removed, expelled from your body. So even less than 6 pills a month could potentially cause rebound for some people. And this is how it happens. So this is how, your once miracle pill that worked so fantastically at the beginning, it gave you your day back, it gave you your life back. It can stop working so well. And then it can contribute to your migraine issue. It can cause you to have more headaches more often. The more you take them, the more likely, and the longer you're taking them, the more likely you'll hit this point of rebound and dependency on the medication. And it does become a vicious cycle because you need to stop the pain. The medication is your tool, right? This is what you've been handed. This is what you've been doing. And so that's what you go to when you feel something coming on. But at this point, it's just leading to more headaches, more pain. And then, you're still reaching for the medication. So this is when your doctor might then prescribe a preventive medication, something, say, you're over 15 days, you're getting these headaches for more than 15 days a month. Let's try you on a preventive. But if you're already getting rebound headaches, then the preventive may not work for you very well, if at all. And, again, because rebound can develop over years, you don't necessarily have to be taking an abundance of medication to get there. A lot of people don't recognize that that's even the issue. So I'm going to pause here. I would love to know whether you're watching the replay or live again. Let me know in the comments if you've experienced this. If you think that that's where you are right now, or if you've experienced this in the past, or if you're not sure that your preventive is working for you because you're still getting headaches and still having these breakthrough headaches. These are all potential signs of rebound. So let me know in the comments if you feel like this is you. And again, I'll mention that you want to make any decisions about stopping medication with your doctor, because some medications can be dangerous to just stop cold turkey. Some medications you can just stop taking, but others you don't want to be doing that, and you need to know how to be reducing them if that's your goal. So I will get into a little bit which medications can contribute to rebound. And it's not just prescription abortives like triptans. Many types of medications, including over-the-counter meds, can contribute. And these include, but they are not limited to, the triptans, like Imitrex and Zomig and Relpax. Relpax was the one that I was on and that I still have, but I'm not taking. And these triptans, what they do is they constrict blood vessels. They constrict blood vessels really everywhere in the body because it can't be targeted. But because they're constricting blood vessels in the brain as well, that's what in your head, that is what is relieving the pain when you have a headache, when you have a migraine headache. So when the medication wears off and the blood vessels swell again, they actually swell to, in Rebound, they're swelling to an even greater degree, and we feel that pain again, but it's even worse. And this is why you take a pill. Let's say you have a migraine, you take a pill, you find like 24 hours later, your migraine's worse than ever. And then you have to take another pill. And sometimes you have to take a second one an hour later after that because the first one didn't work. This is kind of the mechanism that's happening to do that. Other medications that can cause rebound are caffeine-containing analgesics like Excedrin and Midol. So these also constrict blood vessels. Caffeine constricts blood vessels, and this is also the way that you can be experiencing rebound by taking these kinds of pills and too often. Decongestants like Sudafed, they also constrict blood vessels and can cause this problem. Sedatives for sleep can lead to rebound. Butalbital compounds like Furanol can lead to rebound, and of course opioids and related drugs. So now opioids do not constrict blood vessels, but they do bind to opioid receptors in our brain, and the brain, those receptors, they get used to being bound, and when they're not, that's when you get this increase in pain, because it's like calming the pain when these receptors are bound, and when they're not, because the medication wears off, boom, the pain comes back. So these are the ones that are most commonly associated with rebound. So if you're taking these for more than 6 days out of the month, consider that rebound may be causing you additional headaches and or more severe or long-lasting ones. But really, most medications can contribute to more migraines or lead to more migraines, including NSAIDs like ibuprofen or Advil, Naxaprin like your Aleve, brand name Aleve. These decrease inflammation, including in blood vessels. Also, your pain-reducing medication like acetaminophen, which is Tylenol, or aspirin, because the body's natural ability to decrease inflammation and pain gets lazy with these. So these can create rebound or can cause you issues in getting more headaches or more severe pain down the road. And even preventives that are prescribed for migraine, like blood pressure medication, antidepressants, and the anti-seizure meds, they can lead to more headaches. Even medication you're taking for health conditions other than migraine can lead to more headaches. Again, for different reasons, but one of these are that they can build up in the body, that they need to be processed by the liver, which is one of our detox organs. And if the liver cannot keep up with all that's it's being thrown at it, because the liver has a ton of responsibilities, not just detox, not just transforming things, making hormones, transforming hormones. It has a lot of jobs. And so if it's bogged down, then what's happening is it might not be able to do what it should with these medications. And the remnants of these meds float around in the body. They activate our immune system, sees that as foreign. Of course, it's like the immune system has to deal with all of that. And, that means more inflammation that can travel all throughout the body, including to the brain, the blood vessels, and all of that. So if you're not totally sure if you're dealing with medication overuse headache right now, it's something that you can assess with your doctor. It's something that we evaluate inside of the migraine resilience method. But a few things to think about and consider for this are how often you're taking medication, how much do you need to take for your migraines and for your headaches, and how well is it working for you. If you're only taking a pill a month or so, 1 or 2 pills a month or every few months, and you have been for a very long time and it's still effective, it's still stopping the pain, still dealing with your symptoms, then we may not have to worry about medication overuse headache. Maybe, you don't have to even worry about rebound. But if your meds aren't working well, or if you're having to increase the dosage and amount over time, then you may be dealing with rebound or you're on your way there. So, there are a couple other signs you can think of here that I'll tell you about, and that's you wake up in the morning with a migraine very often, or you find yourself being woken up in the middle of the night by a migraine. You just jolt, you wake up and it's there. It wakes you up, or you wake up and it's there. This can be a sign that medication is wearing off and your body is asking for another pill. So it's that dependency and that rebound effect. Or if you started taking preventives and when you did that, they just didn't work. They didn't work very well. Like, say, maybe they cut your headaches back by 1 or 2 a month, and when you were getting more than 15 headache days a month, and it barely kind of barely put a dent in things, or they just didn't work at all. Nothing happened. So, I mean, this would happen if, again, you're exceeding about 15 headache days a month, and usually your doctor will try a preventive for you, just so you're not taking so much over-the-counter medication and abortives, again, to avoid being in that rebound phase. But, you might be put on the preventive, but if you're already in rebound, it's probably not going to work. It's more likely not to work. So, yeah, the potential's there that's what's happening if it's not working for you. So I would love it if you could drop a number in the comments how many years you've been taking medication for your migraines for. And it's totally understandable that you want to get rid of pain and that you would take a pill to stop the pain. I've done it, and I still would do it if I had to. If I didn't have an alternative or know about an alternative, didn't have an alternative in place that worked, then I would. And, I still definitely have in the recent past, very rare occasion now though, because I have my tools and I know why it's happened. I know why I have a bad migraine. It's me getting off strategy, me getting off my plan, and things building up again. But if you're in rebound, it starts to make less sense to just take a pill, unfortunately. The quick fix isn't so, it's not so appealing anymore. So when those pills are adding to our pain, when we know they're creating more frequent pain, and I do hope this makes as much sense to you as it does to me, that we should be finding alternative ways to not just manage migraine episodes when they're happening, but actually prevent them from coming on in the first place. So I will conclude with talking about how to get out of rebound if you are there. Now, the only way to get out of rebound and to be able to try some of these alternative approaches, because otherwise they're not going to work well for you. They're not going to work, including the preventives, if you still want to go that route. But the only way to try alternative approaches and get effective results is to stop taking the pain medication. Unfortunately, to get out of rebound, you have to stop taking the medication that's causing it. And this, of course, sounds really scary, but it is a lot less scary if you have a plan and if you do it properly. And so I'll go through the core steps that I recommend for doing this. Again, let me know if you have any questions about this along the way. I don't see any comments so far, but I know people are going to be watching this. I know that you're going to be curious and still have questions, even though I know I'm covering quite a bit here, but it's I know it's a big topic, so don't be afraid to ask. I'm sure others will have the same questions as you, so definitely put it in there. So step one, after you make the decision, let's say to reduce or eliminate meds, because you suspect rebound, because you don't want to take the medication anymore, you're not happy with taking it, you just want to move away from it, try something different that's going to be more effective. It's you that gets to decide this. It's you that gets to decide if you want to move away from medication, not your doctor, not anybody else in your family. You get to decide if you want to try something different, to feel better, and especially if the medication's not working well. So the first step is to have a conversation with your doctor after you make that decision. That's what you think you would like to do. And ideally, you'll get their support, and they will, you'll get the support, and you can mention what you want to do, what your goal is, and then they will say, okay, I will support you to do that. And they'll advise you on the safest way to get off of meds, because some types, as I mentioned, have to be tapered, including many of the preventive meds, especially. So that's step one. Step two is that you want to prepare your body for the process of getting off the medication. And in the migraine resilience method, we make sure that important first steps are taken to get your body to a place where it is as healthy as it can be, to a place where it's healthy enough to be able to start to get off that medication, because you're confident that it can actually take over the job that the medication was doing again. Like I mentioned, the body can get lazy with managing pain, with managing inflammation, because medication was doing that job for it for so long. Also, you want to be making sure that you're able to detox the medication that you've got. Otherwise, it's going to contribute to more migraines, and you're not going to have the plan in place. You're not going to have the healthy body and the tools to deal with them. So this is step two: to get healthy, to go through the process of getting your body healthy, and that means dealing with imbalances. That means dealing with imbalances and deficiencies, and anything that is causing the body extra burden and extra effort to do its thing, to stay in balance. And this is before you get off the medication, because pain, it can intensify in that withdrawal period from medication. You can experience worsening migraines, worsening headaches, but it's going to be much less and much better. And for some people, they'll go have an easy time. Others will have a really rough time, but it's going to be so much better if you do this prep work first. So that's step two. Step three is to devise a plan for what you do when you do get a migraine, because when you come off of medication, chances are you are going to still have some migraines, and as I mentioned, perhaps even some worse ones initially. But if you don't have a plan, that's going to be very stressful. You're going to be tempted to take medication for it, of course, to stop the pain, but that just delays the process of getting out of rebound, and you may not ever get there if you keep falling back into that, medication trap, or taking medication for your pain. So you risk not seeing your results if you don't have an alternative to taking medication in that period of time, and for migraines that you may still get beyond exiting rebound. And so having this step in place will give you that confidence to get through the rough days, and, maybe even prevent some migraines already off the bat, to start preventing them with a plan. Step four now is to support the body and continue to work on the underlying root causes, so that you can further reduce the severity and the intensity and the frequency of your migraines, the episodes you're still having once you're out of rebound, if you're still getting those migraines. If it wasn't, for some people, getting out of rebound is enough to practically eliminate their headaches and migraines. Others, they still have got some residual stuff going on, and it's, of course, still working at those root causes that it will get you even further. So without doing the prep work and the planning, the process will be more painful, more stressful. That will just perpetuate the cycle of increasing inflammation and creating more migraines. And of course, as I mentioned, this will prevent you from succeeding in getting out of rebound. So I want to offer to you to reach out if you want to talk about this, how I can support you through this, because this is something that you can get personalized support for. We do this in the migraine resilience method. You can first get help with evaluating whether you may be in rebound. We, of course, investigate possible root causes for your migraines, those imbalances and deficiencies, and we start to address them one at a time, or one step at a time, I should say, because a lot of times, we can tackle a lot of things by doing some core things and getting at backing it up to the very first few roots or root that addresses many things at the same time. So it's not like you have to tackle individual health issues one by one by one and take years for it to, to come to to see any results. You're not tackling one thing at a time. This is we're looking at this as like an integrated system. Our body's completely interconnected. So you deal with one health issue, other health issues you'll see resolving if you're getting at the roots and not just managing symptoms. So, yeah, we address things one step at a time. We look at raising your resilience overall, raising your migraine threshold so that even before you stop taking, before stopping your medication, you may already start to see an improvement in your migraines and headaches. And I know I said you have to be out of Rebound for the most part for other things to work, but it's not always the case. And of course, you're going to see some improvements when you start to do these things. So you'll start to see even a shift in symptoms. If it's not your headaches and migraines, you'll start to see a shift in other symptoms before you come off of the medication. But we want to make sure that your body is prepared to handle the detoxing of medication and that you have a strategy in place to naturally prevent attacks and to naturally manage your migraine attacks as you move through the rest of the program. So today, what I hope gets across is that there are alternate ways to address migraines that do not involve medication. In my view, and in the view of all the functional medicine world, the functional health world, practitioners, doctors, there are much better ways to deal with this chronic disease of migraine that won't lead you down a path of increased reliance on medication or additional health issues. So if you're open to this, if you're curious, then reach out to me, send me a private message, you can comment. And if you have any questions about this, even if you're watching the replay, as I mentioned, put them in the comments. I'll do my best to answer them later. I can reach out to you privately as well. And I will definitely be talking about this again. It's a big topic, as I said, and I'll be talking about it again, but it does help me to know what kinds of questions you have so that I can address them specifically. So I hope you all have a good rest of the day, have a good weekend, and we will be in touch again soon. Bye.